48-year-old man with possible right hemipelvis instability. There's a slight amount of opening anteriorly. So this patient goes to the operating room for examination under anesthesia and stress tests showing opening of the right sacroiliac joint, as you can see on the image on your left. And the left side does not open. So we see that the right sacroiliac joint and the pubis symphysis are widening under stress. So the patient's taken to the operating room and the front is fixed with a plate and screws. And then we again use the CurvaFix implant, initial insertion of the steerable guide wire after opening reaming in order to fit the implant within the S1 corridor. And you can see on the left there, that's what the entry looks like for the entry reamer on this intraoperative CT scan. And then the guide wire is placed in the correct location, followed by reaming, exchange tube, a non-ball tip guide wire. And then the implant is inserted, and you can see that it follows the guide wire, but actually follows the inner walls of the corridor of the sacrum in this location. And that's why you see some curvature of the implant as it basically moves its way through the corridor to stay within the bone. The outlet view on the left, how there's a nice curvature right at the point where it's probably the most dangerous, which is around the S1 foramen on the right side of this patient. And on the right side, you see, on the right image here, you see how the CurvaFix implant is inserted and flush to the outer wall of the ilium. And 6 months post-op, no change in implant. The bone is healed. The patient is walking without any difficulty.